BAC's framework and philosophy is really designing and operating navigation centers that are based on low barriers and based upon treating people as individuals and treating people with respect and dignity and really treating people like adults. My name is Jamie Almanza, and I'm the Executive Director of Bay Area Community Services. BACS as an organization has been around for 60 plus years, and we operate multiple navigation centers, one in the city of Berkeley and two in the city of Oakland. And a navigation center essentially is a place where individuals who are experiencing street homelessness can immediately come off the streets and live in a warm, safe area while they are actively with us looking for permanent housing. They're also able to really come as they are. So people who have a mental health issue or a physical disability, they're able to also access the navigation center. The center itself provides 24-hour respite from the streets. It provides a warm meal per day, showers and bathrooms, ample storage for individuals, and all during that time that they're living at the navigation center, they are working with a housing navigator. And so that really looks like conducting a housing assessment and housing plan right when they move into the navigation center, with the sole goal that when they leave, they're moving into their own permanent housing placement with their own signed lease. And what's most important is that they can sustain their that housing placement on their own. So in the year plus that BACS has operated the Navigation Center in Berkeley, we've served over 90 individuals, and 82% of those 90 individuals have moved into permanent housing. And that is such a large impact on the city of Berkeley, who has experienced an increase in their unsheltered homeless residents. And so the Navigation Center was really designed as a very quick intervention to not only get individuals off the streets, but to really end their street homelessness permanently in that time. So since BACS has operated the Navigation Center in Berkeley, there has not been any community challenges in the year plus that we've been living here. The center opened last June of 2018, and in that time we've had zero complaints or concerns from the immediate neighbors and from the community at large from the city of Berkeley. And I think we continue to see that we're good neighbors, being a navigation center in the city of Berkeley. One of the most important criteria in selecting where a navigation center site is that it's conducive to people really accessing the needed resources and benefits that they need to find permanent housing and to be successful in leaving the navigation center. With that said, the further a navigation center is situated in a community, i.e. when there is not ready access to public transportation and just amenities that the average community member relies upon to be successful in their day-to-day lives, less outcomes ultimately in reducing street homelessness in a community. And so in the city of Berkeley's Navigation Center, while it is nestled in an industrial neighborhood, it is still 2 blocks away from major retail and residential areas where people live and go to work and shop. And so I think it's very important that as Fremont is considering where it ultimately places its navigation center, that it really pays attention to resourcing the navigation center and the participants living at the navigation center with very basic amenities. We've never experienced navigation centers that have increased challenges or crime. Within the navigation center itself, the target population really ends up being twofold. It is either someone that has permanent disabilities and is on a fixed income, or it's a population who is really what the government would deem work ready and is able to hold a competitive job. And so the Navigation Center works with both parts of the population to either help them find work if they're able to work, and or helps them really ensure that their permanent disability status is achieved and that their fixed income will help them sustain permanent housing. The nice thing about the Navigation Center model is that there's a phase after they find their permanent housing called the aftercare phase, and that phase includes staff who are able to really go into the community where people are housed and really provide support in that permanent housing placement. And that type of support actually ends up being almost the most important part of the entire intervention, because we want to make sure that the housing itself is successful and that people maintain the permanent housing that they've worked so hard to obtain. The types of housing we're finding for people are really a wide range, and one of the things that's most important about the Navigation Center and the housing navigation staff is that they are looking for housing on an individualized basis, based upon what the participants' resources and income are, what kind of housing they would be most successful in, and certainly and most importantly, what housing that they can sustain in the long run. Types of housing generally include shared housing, where an individual perhaps rents a bedroom in a house. It may include housing where they're moving back with family and or friends, but that they hold a lease of their own and pay rent into the household. It may be an individual unit, and or for a very small group of people, it may be permanent, affordable, supportive housing where people pay a third of their income for the rest of their lives. A Navigation Center is designed and built as a solution to end street homelessness in a community and to, in an overall sense, create more health and wellness and safety in that community.